Every year, millions of seniors roll up their sleeves for health checkups, believing they're protecting their future. But what if I told you that some of those very tests, the ones most doctors recommend without a second thought, could actually do the opposite? What if they increase your risk of surgery, stroke, or even cancer? It's a hidden truth buried in the research. Up to 37% of medical tests in people over 70 lead to unnecessary treatments, complications, or long-term side effects. And here's the real kicker. Nearly 99% of seniors have no idea they're being over-tested. Some of these routine exams sound harmless, just another box to tick during your yearly visit. But the reality, they can quietly ruin your quality of life. One of them, the number one on our list, is responsible for as many cancer cases in the US as drinking alcohol every single day. Yet, you won't hear about it in your clinic, you won't see it on a billboard, and it's definitely not part of your doctor's small talk. That's why today we're pulling back the curtain. These are 5 health checkups you should avoid after 70, and the unsettling truth about what they can do to your body. All backed by science, all explained in plain English, and trust me, you won't believe what made it to number 2. But before we dive in, I want to hear from you. Where are you watching from? How old are you? And have you ever regretted a test or procedure? Drop your story in the comments. We reply to every single one with personalized tips. And of course, don't forget to hit that like button and subscribe for more videos that reveal what most health professionals won't tell you. All right, let's get started. The first test looks completely harmless, but it can quietly push you toward medications that wreck your health instead of saving it. Bone density scan. It sounds harmless, right? Just a quick scan, no needles, no pain, and you walk out thinking you know how strong your bones are. But past the age of 70, this simple test can do more harm than good. The scan is called a DEXA scan, and it measures bone density. Doctors often use it to check for osteoporosis. But here's the catch. After 70, almost everyone shows some level of bone loss. Not because they're sick, but because aging naturally lowers bone density. It's like getting wrinkles or gray hair. It happens to everyone. The problem is what happens next. A scan that shows mild bone loss often leads to prescriptions for powerful drugs called bisphosphonates. These are supposed to strengthen bones, but they come with side effects that sound like something out of a medical horror story. Painful heartburn and esophageal irritation, brittle bones that break in strange ways, and in rare but terrifying cases, jaw necrosis, a condition where part of the jawbone literally starts to die. And here's the kicker. Studies show that for people over 70, treating mild bone loss with these drugs barely reduces fracture risk at all. One study followed more than 1,200 women and found that after 5 years on medication, the risk of fracture only dropped by 0.3%. That's practically nothing compared to the risks of the drugs themselves. Take Rose, for example. She was 76, a retired piano teacher, active, healthy, and had never had a fall. During her checkup, she was sent for a bone density scan. The results showed mild osteopenia, not even osteoporosis. But her doctor still prescribed bisphosphonates. Within 3 months, Rose developed severe reflux and jaw pain so bad she couldn't play piano. When she finally came off the medication and switched to a plan of vitamin D, resistance exercises, and calcium-rich foods like sardines and leafy greens, she didn't just recover, she became stronger. A year later, she was back to performing recitals with more balance and confidence than before. The real truth is that for most people over 70 who haven't had fractures, lifestyle changes work far better than medication. Weight-bearing exercise, strength training, balance practice, good nutrition, and treating vitamin D deficiency can reduce fracture risk by over 20%, according to recent research. Compare that to the 0.3% from drugs, and the choice is obvious. So yes, the DEXA scan may look like a harmless way to stay safe, but in reality, it often sets off a chain reaction of unnecessary prescriptions and painful side effects. And if you think that sounds scary, wait until you hear about the next test, because unlike a harmless bone scan, this one can set you on a path towards something even more terrifying: brain surgery. Brain MRI for memory loss. When seniors start forgetting names, misplacing keys, or feeling a little more confused than usual, fear sets in fast. Fear of Alzheimer's, fear of dementia. And in many cases, that fear drives doctors to order a brain MRI. On the surface, it sounds like the right move. An MRI is a high-tech scan that shows detailed images of the brain. But here's the shocking truth. In people over 70, MRIs rarely provide clear answers, and more often, they create problems. That's because the vast majority of MRIs in older adults show age-related changes, things like white spots on the brain or slight shrinkage. These are completely normal in aging. But the moment they show up on a scan, patients panic. Doctors order more tests, and in some cases, it snowballs into invasive procedures that were never needed in the first place. A 2021 study reviewed more than 3,000 MRIs in adults aged 70 to 85 who had mild memory complaints. The results? 86% showed abnormalities, but only 3% of those findings were linked to conditions that were actually treatable. That means 97% of seniors walked away thinking something was wrong with their brain, when in reality, nothing was. And it doesn't stop there. Nearly 11% of those patients were pushed into invasive follow-ups, like spinal taps or even exploratory brain biopsies. Imagine that, all because of a scan that was never likely to give useful answers in the first place. Let me tell you about George. He was 74, a retired engineer, sharp, independent, but he admitted he was misplacing his keys more often and forgetting names. His doctor immediately ordered an MRI. The scan came back showing white matter changes. George panicked. He convinced he had dementia. He stopped driving. He stopped going to church. He withdrew from his community, spiraling into anxiety. But when we actually tested his memory with a simple paper-based exam, George scored perfectly within the normal range. His MRI changes were nothing more than normal aging. What he needed wasn't surgery or medication. He needed better sleep, hydration, and brain exercises. Within 3 months of focusing on lifestyle, George's memory felt stable and his confidence returned. This is the untold truth. Unless there are severe symptoms, sudden changes in personality, seizures, or a rapid decline in function, an MRI for mild memory loss doesn't help. Instead, it often traps seniors in a cycle of fear, extra tests, and sometimes even brain procedures that can make things worse. So, what should you do instead? A cognitive screening test. It's simple, cheap, and far more reliable as a first step. It checks your memory, attention, and problem-solving skills without the risks of an MRI. And more often than not, it's all that's needed to know whether your memory issues are just part of normal aging or something that truly requires more attention. That's the safer path. But now, let's shift gears, because the next test isn't just about fear, it's about the heart. And while doctors swear it's a life-saving tool, in seniors over 70, it can lead to false alarms, dangerous procedures, and long hospital stays. Get ready. Number 3 is one of the most common tests in America, the cardiac stress test. It's one of the most common tests doctors order for seniors who complain of fatigue, chest tightness, or just not feeling like they used to. The cardiac stress test. On the surface, it seems smart. Put someone on a treadmill, monitor their heart, and see if their arteries are clogged. But after 70, this test can be a dangerous trap. Here's why. Stress tests in older adults have an alarmingly high rate of false positives, meaning the test says something's wrong when it isn't. In fact, studies show that in seniors, the false alarm rate can be as high as 40%. That's nearly half of the people tested. And what happens when a test falsely suggests a heart problem? More tests, more procedures, and sometimes unnecessary surgeries that can carry life-threatening risks. A 2017 study in JAMA Cardiology revealed something shocking. More than half of all stents placed after stress test referrals were done in patients who had no clear symptoms and got no survival benefit at all. What they did get, however, were complications, higher rates of bleeding, kidney injury from contrast dyes, and longer hospital stays that robbed them of their independence. Take Raymond, for example. He was a 75-year-old retired postman who loved staying active by walking every day. During a routine checkup, he mentioned feeling tired on steep hills. His doctor, wanting to be cautious, scheduled a stress test. The results were unclear, so Raymond was sent for a catheterization, where a tube is inserted into the arteries to check for blockages. They found a mild narrowing and placed a stent. But that night, Raymond developed kidney problems from the contrast dye. He spent 6 days in the hospital, weak and exhausted. And here's the cruel irony. His fatigue never went away because it wasn't a heart issue to begin with. He just needed better hydration and rest. Instead, he went through a risky procedure he didn't need. This is the hidden danger of stress tests in seniors. They often start a domino effect that ends with unnecessary stents or bypass surgeries, procedures that don't always improve survival but can shorten quality of life. So what's the better approach? If you're over 70 and don't have classic heart symptoms like chest pain during activity, shortness of breath that worsens with exertion, or sudden drops in stamina during light exercise, a stress test may do more harm than good. Safer options include a resting EKG, which checks the heart's rhythm while you're at rest, or a coronary calcium scan, which uses low radiation to look for plaque buildup. Both are quicker, simpler, and far less likely to push you into a cascade of unnecessary treatments. The truth is, not every strange heartbeat or moment of fatigue needs high-stakes testing. Sometimes careful observation and lifestyle changes are the safest medicine. But if you think that's alarming, just wait, because the next test is one that almost everyone over 50 has heard of, and after age 70, it becomes one of the riskiest procedures of them all. Let's talk about number 2 on the list, the colonoscopy. Most people are shocked to hear this one. Colonoscopies are often described as the gold standard for preventing colon cancer. And for adults in their 50s and 60s, that's true. But after age 70, and especially beyond 75, a colonoscopy can quickly shift from helpful to harmful. Here's why. The preparation for the procedure is intense. Seniors have to drink strong laxatives that flush out the intestines. For younger adults, it's uncomfortable. For older adults, it can be dangerous. The prep alone can cause severe dehydration, dizziness, or even kidney problems. Then comes the sedation. While younger patients usually bounce back quickly, seniors often experience confusion, brain fog, or even longer-lasting declines in memory after anesthesia. And that's before we even talk about the test itself. During the procedure, there's a risk of bleeding, bowel perforation, or heart rhythm disturbances triggered by sedation. These complications rise sharply with age. A massive study in JAMA Internal Medicine followed over 1.3 million Medicare patients who had colonoscopies at age 70 and older. The results were eye-opening. For every 1,000 colonoscopies in people over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. And yet many seniors are still encouraged to get routine colonoscopies, even if they've had clean results before. Take Dana, for example. She was a 73-year-old grandmother who ran a bakery with her daughter. She felt great. No symptoms, no family history of colon cancer, and no changes in her digestion. But her new doctor urged her to get a screening colonoscopy just to be safe. She agreed. During the test, a small polyp was removed. That night, Dana doubled over in pain and fainted. At the hospital, doctors found a bowel perforation. She spent 9 days in recovery, lost weight, and struggled to get back to her normal life. The cruel part? She had already had 2 clean colonoscopies in the past. There was no reason to repeat it. This is the reality most seniors never hear. Beyond age 70, colonoscopies are rarely worth the risk unless there are very specific symptoms, like blood in the stool, unexplained weight loss, or severe digestive changes. The U.S. Preventative Services Task Force is clear. For most people, routine screening should stop by age 75. So what's the alternative? A simple, non-invasive stool test called a FIT test. It can be done at home, involves no prep, no sedation, and still detects most concerning cases. For older adults, it's safer, cheaper, and far less disruptive. The bottom line is colonoscopies aren't always the life-saving safety that they're made out to be, especially in seniors. Sometimes the risks outweigh the benefits, and the safer choice is knowing when to stop. But here's the thing. As dangerous as a colonoscopy can be after 70, it's nothing compared to what's coming next. The number 1 test on this list isn't just unnecessary, it could actually cause the very disease it's supposed to prevent. Let's talk about the most harmful checkup of them all, the full-body CT scan. It's marketed as cutting edge. Some clinics call it the ultimate health check, promising to catch hidden cancers and diseases before they become dangerous. Wealthy patients even buy executive packages that include it as a premium perk. But here's the shocking truth. A full-body CT scan is one of the most dangerous tests a senior can take, and it could actually cause the very disease it claims to prevent. Here's why. A full-body CT scan exposes you to a massive dose of ionizing radiation. Each scan delivers the equivalent of 500 chest X-rays in one sitting. That's not harmless. Radiation at this level damages DNA, increases cancer risk, and in seniors, where cells are more vulnerable, the dangers multiply. A 2023 study published in JAMA Internal Medicine revealed that the rise in CT scans may now account for up to 5% of all cancers in the United States. Think about that. 1 out of every 5 cancers could be linked to a medical test that was supposed to keep people healthy. That puts CT scans in the same risk category as daily alcohol consumption. And it doesn't stop with radiation. CT scans are notorious for finding incidentalomas, tiny spots, nodules, or cysts that are usually harmless and simply part of aging. But once those spots show up on a report, they trigger a cascade of follow-ups, more scans, biopsies, even surgeries, and every extra test carries new risks. Let me tell you about Marcus, an 80-year-old who still taught martial arts to younger seniors. He was strong, sharp, and active. During a private elite checkup, he was offered a full-body CT scan. The scan found a tiny lung nodule, only 3 millimeters wide. His doctors panicked. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The result? Benign, harmless. But during the biopsy, Marcus's lung collapsed. He ended up in the hospital recovering for 2 months, his stamina permanently reduced, all because of a tiny spot that never needed treatment in the first place. This is why the American College of Radiology is blunt. Full-body CT scans should never be used for routine screening in people without symptoms. There's no evidence they save lives and strong evidence they can ruin them. Of course, there are times that when targeted imaging is important. If you're coughing up blood, losing weight rapidly, or showing a new visible lump, then a CT scan focused on the problem area makes sense. But scanning the entire body just in case is like searching for treasure with a landmine detector. You might find something, but the explosion could cause far more damage than what you were looking for. The real key to prevention isn't blasting your body with radiation. It's listening to it, staying active, eating well, sleeping deeply, and managing stress. These are the habits that have been shown, time and time again, to add years of quality life. Now, I want to hear from you. Have you or someone you love ever gone through a medical test that turned out to be unnecessary or even harmful? Share your story in the comments below. Your experience might be the one that saves someone else from going through the same thing. And if this video opened your eyes to the hidden risks of routine checkups, make sure to like this video, subscribe to the channel, and hit the notification bell so you never miss our deep dives into the truths about health that most people will never hear in a doctor's office. Because your health is too important to risk on unnecessary fear. Sometimes less really is more.